The next part in our conversation about the ongoing crisis of toxic opioids in Barrie is a conversation with the Canadian Mental Health Association's Simcoe branch. In Barrie, the CMHA focuses on the issue of mental health and issues surrounding that, how closely it's tied with addiction and with the toxic opioid crisis. A key part of this discussion is just that, how the stigma around of addiction reinforces prejudice, which are harming people in our community who use opioids. And a way that BCM can hopefully add to this discussion is through long-form conversation like this. Because there are news articles keeping up to date with the everything to do with the supervised consumption site discussion and how that's moving forward, petitions, groups calling for change. But hopefully these long-form discussions about the same issues can offer you a chance to go beneath of these topics of the news, to listen to those who are devoting massive amounts of time to promoting change and saving lives in these areas. In this conversation, I speak to 3 CMHA staff members, including the Simcoe branch's CEO, Dr. Barrie, themselves right off the bat, and then we dive into a discussion on the root causes of addiction and the spectrum of addiction as well, and how the pandemic has caused a shift in their service delivery and the challenges that brings up as well. This is the next step in our coverage of the toxic drug supply crisis in Barrie. And again, it's a multi-layered issue. So just remember that the conversation doesn't stop here. We'll be bringing on more perspectives, more voices in the coming weeks. To start off, could you just introduce yourself, your pronouns, and your roles within the CMHA? And I'll start with you, Dr. Gudi.
I am the CEO of CMHA Simcoe County. This is my 10th month having joined the region, and it's been such a privilege to work with such fabulous people. And I am known as she and her.
Perfect. I'll get you to go next, Kim.
I am Kim Barrie. Pronouns are she and her. I'm the clinical team lead for the addiction services at Canadian Mental Health Simcoe County.
I'm Meredith Freya. My pronouns are she and her. I'm the addictions manager for CMHA Simcoe County. I've been with CMHA for about 15 years now, and I've been in the field of addictions for 19 years. So very happy to be here.
And for people who may not know or may not be familiar with your organization, I was wondering, Dr. Gudisa, could you kind of give a brief of the CMHA?
Well, thanks so much, Sam. So overall, our core mission is to work in collaboration with individuals and their families, offering that full spectrum of addictions and mental health services. And it's based on a philosophy of recovery and a respect for each individual's uniqueness and choice. So what does that actually mean? So we actually do provide 24/7 services on our crisis line where we're responsive to your immediate needs, so we can link you to the right services and supports. We also have a 24/7 crisis program where there's beds where you can stabilize. We serve also some of our most vulnerable populations that have severe and persistent mental illness through our ACT teams. And as you have just met 2 of our leaders in the addiction services, we provide the full range of community-based addiction services, as well as opioid-related services as well. We work with youth in our early psychosis intervention program and our youth mental health services. We also have funding from justice related to our human services and justice system. So we have a release for custody and housing programs. We have a homelessness initiative, and we even have a clubhouse for people to come to, not during our pandemic days, but when we get back to that new normal, to enable people to actually connect with others with the lived experience of addictions and or mental illness.
And I'll direct this one to you, and then I'll extend it to both you, Meredith, and Kim. But how has the pandemic kind of changed the operating procedures of the CMHA?
Well, that's a great question, Sam. So really at the beginning of the pandemic, we quickly pivoted to a blend of virtual services and supports, but we still maintained our in-person services and supports because we all know for individuals that are struggling or vulnerable or maybe their illness has become unstable, that there is certain individuals that benefit from in-person services and supports. We never stopped that, but we did build out new approaches, new systems and structures to provide virtual care, which means that people can link to us through the telephone, through their computers, and we provide both individual supports and group interventions via virtual care.
Okay, and then now in terms of the departments that both you work in, Meredith and Kim, how has the pandemic caused challenges, or how are your teams kind of adapting to working within the pandemic? I'll start with you, Kim.
It was a bit of a challenge first because we weren't expecting to all of a sudden be working from home and doing everything virtually. Everybody got on board very quickly, became more comfortable with the different way of providing service, and they're finding they're enjoying the freedom that comes along with being able to provide service or receive service either over the phone or over the computer. And in terms of the pandemic impact overall, we're seeing that for many it's making things a whole lot worse, and others are finding that it's actually really beneficial for them.
Have you seen that as well, Meredith, in the people that you're working with and the team that you help operate?
Definitely. I think that when we switched to virtual care, we weren't sure how many clients we would have that would really be interested in that type of modality. And we've actually found that it's been really widely accessible for a lot of people. A lot of people have found it very much easier, particularly if they're working, to be able to access us by phone on their lunch break or in their car on their way home. We're finding it much easier for people who may have found it challenging to get to the office. They're finding the virtual palatable to them and much easier to access. So what that's taught us is that going forward, even post-COVID, we will continue to offer virtual care as one of our modalities of service. So we will continue to offer that because we know that there's been a number of clients who've really benefited from that and have found that to be preferable to the in-person.
Okay, and so one of the things I'm kind of focusing on in a lot of our coverage recently is the opioid crisis in Barrie. And from some of the stats that I've seen, that crisis is getting worse and noticeably worse during the pandemic. And I'll start with you, Meredith. I was wondering, how have you seen the pandemic kind of impact the state of the opioid crisis in Barrie, or the state of addictions and mental health in that area?
Well, so what we do know is that opioid overdoses have actually increased during the pandemic, and significantly increased. And we know that people are finding it more difficult because they're more isolated. They don't have as much access to their social supports, just their social network as well as services. And so I think that that's really been a detrimental effect for a number of people. It's one of the reasons why we are continuing to ensure that we reach people as much as possible, that we have outreach to shelters, that we ensure that because we know that at this time is the time when people are needing it most, or needing support most, and are finding it the most challenging because of the lockdown restrictions, or even just where they're located, trying to find ways to get out and see people. So definitely it's had a significant effect. It's really ensured that we've made sure that we're doing as much as we can to support people in whatever ways we can, and ensuring obviously that there's the availability of naloxone as well, and really making sure that continues to be available.
Kim, have you seen that as well in the area that you're working in the CMHA?
Absolutely. We're in the same program.
Oh,
so
yeah.
It's the same pretty well across the board in all of our locations around Simcoe County.
And so I'll get back to the questions that I passed along. And so Meredith, I was talking to a mother of a man who passed away due to the toxic drug supply. And she was saying that a lot of the people she talked to kind of viewed his experience with opioids as like a moral failing. But I was wondering, could you kind of talk more about the relationship between mental health and addiction?
Definitely. So there's definitely between mental health and addiction. And we know that very often when people are seeking services for substance use, there may in fact also be diagnosed or undiagnosed mental health issues. And very often people are trying to cope with those issues and finding ways to manage them. We know there's also a very high correlation between substance use and a history of trauma. And so we know that people often are finding ways through substances to cope with those intrusive, debilitating symptoms, and are finding a way to get relief from those symptoms. And so it's also important to know that the substance sometimes initially is actually helping people. It's medicating emotional pain. There's a lot of issues that people maybe don't know how to deal with or aren't sure how to manage. And this substance has symptoms, that emotional pain relief that they were getting when the substance is not present, that can resurface and can be absolutely debilitating for the person or absolutely overwhelming. And that plays a significant role in the cycle of relapse. So it's a very complex issue, and there's a lot of layers to it. But what's really important is not to be looking at the substance use itself, but to be looking at what's underneath that, what's driving that bus forward, because that's really the core of why people are continuing to use. It's a way to cope. It's often a way to cope with significant pain. And also sometimes it's very important to know that people are often using substances as a way to function. So we often associate substance use with a decline in functioning or inability to function. But in actual fact, a lot of times people are using substances so that they can get on with their days. They can do the things that they need to get done. So very complex, but really the substance is the symptom, and the underlying issues are the pieces that are really.
And what does that look like in the work that you're doing? How does the prejudice or stigma against that use substances affect the work that you do?
It's interesting. It's sort of two really, because we have both community stigma and prejudice, and then we have self-stigma. And staff, when we're supporting individuals, tackle both of those at the same time. Many people don't feel like they are worthy of change, worthy of being well, or deserving of that, partly due to the way that the community has made them feel, and over the course of time, how they end up feeling themselves. So we're constantly challenging with the individuals, challenging their own sense of stigma, while working externally with the community to try to bring a better understanding, to make for a softer place to land, a more welcoming and embracing community that can help to support them in change, as opposed to turn them away and reinforce that feeling that they're not deserving.
And I guess for you, Dr. Agrigis, you have extensive experience in many areas of Canada, kind of spearheading health campaigns and working on policy in those areas. How have you found this process in Barrie, kind of addressing the prejudice and stigma, or kind of moving new policies and programs into place? What does that look like in Barrie for you so far in this role?
Well, to tell you the truth, coming back to mental health and addictions, because I did have a 10-year journey across the nation and working in other jurisdictions, and being a Southern Ontarian, I do feel like I've kind of come home, to be brutally honest, and that, I'm working and partnering and collaborating with like-minded individuals. I've only been in the role for 10 months, but I say that the Barrie City Council has been very welcoming and informing, and some reached out to me in my early months just for me to really understand some of the local context, including Mayor Lehman. And then obviously, I think you probably have seen in the discussion around some type of state-of-the-art social services or health services campus. So I just had the privilege of meeting with MP Shipley and Broussard and MPP Downey and Congen last week with the Barrie BIA. So, I think for me, as someone that's worked with and in government, what I really love about this early experience is that we're having the really difficult conversations about the complexities of this client population, especially in relation to opioid use and the supervised consumption services. And there's been some difficult conversations because you'd already mentioned the whole construct of moral failing. I think it's easy to think that an individual that is using substances, that there was some weakness in them. But as Meredith and Kim just shared, for someone to get to that state of being, there's a whole history often with intergenerational trauma or significant loss, and or just the biology of the brain, where it does actually, any type of substance help settles us. And unless you're someone that abstains from all substances, I mean, myself, I enjoy an odd glass of wine, and I know that when I have that, it takes me down a notch in terms of my own, individual stressors. So I think as a society, we have to really come together and understand the complexities. The other thing that I always say, I'm someone that has worked with the predominantly youth struggling with mental health issues and or using substances is that, especially with the opioid crisis, you know, we have a 50-year history of opioid prescription that precedes the current crisis. And as someone that worked in Alberta and was on, you know, the executive team of the Ministry of Health, we called it a tsunami that came over the mountains, the opioid crisis, because we saw, you know, in 2014, 15, how prevalent it was in BC. And then when I was sitting at the tables of the boardroom for the Ministry of Health in 14, 15, 16, the rates increased substantively, and it just spread across the nation. Prescribers accountable for their prescribing practices related to any type of substance.
And the opioid crisis is getting worse in Barrie, with here in particular. And there's still no set location for a supervised consumption site in the city's downtown. I was wondering, either Meredith or Kim, options are available now for people that are living with addiction that puts them at risk to opioid toxicity. And maybe I'll start with you, Meredith.
So I think that we definitely need an STS. We definitely need an STS in Barrie. That's definitely a critical need here. However, we do also have other additional addiction services right now. One of the things that I think is important to know is that when we get an STS, that will be a complement to the existing services that exist in this region. Currently, our agency provides individual addiction counseling and group addiction counseling for anyone that's concerned about their substance use at all. We also provide services for significant others, so who is concerned about someone else's substance use and feels that they need support for themselves as well. We also provide individual counseling for them. There is also the RAM clinics exist, and they provide counseling as well as pharmacotherapy for addiction. There are some residential treatment centers that have continued to operate throughout the pandemic. And so our agency can definitely provide referrals for anybody that is interested in attending residential treatment. A number of self-help meetings, so things like NA, AA, have actually moved to an online model. So while it may not feel safe to be in a meeting room, they can actually meet virtually and have transitioned to online meeting format. So those options are available. And as I mentioned before, continuing to access harm reduction supplies so that people continue to have access to naloxone kits and to needle exchange kits and safe inhalation kits so that people can ensure that they are staying as safe as possible.
And maybe I'll change the question slightly for you, Kim. If a supervised consumption site was kind of put in Barrie's downtown, how would that change the work that you're doing in terms of kind of helping people navigate mental health issues and addiction issues? Would that have a noticeable change in your day-to-day work?
I'm not sure it'll have a change in our day-to-day work. It'll just be another additional resource for the individuals who are using drugs. It'll perhaps make for some faster and easier connections to services and get them connected with us and the other community resources that are out there. In the end, what we do will remain the same in terms of providing the individual and the referrals.
And I guess to finish off just a couple more questions, I'll loop back to you, Dr. Gurdisa. Earlier mentioned that in her mind, and coming together to combat COVID-19 and the danger that it's causing to people in our communities. And she said that she wants to see all levels of government coming together to combat the crisis of opioid toxicity. Do you think is that an apt comparison? Do you see the correlation in kind of comparing those two responses?
Yeah, I totally do. And, you know, it should have happened well before the pandemic. And in so many ways, the pandemic has revealed, you know, off of something Meredith shared, there were 94 confirmed and probable opioid-related deaths in Simcoe Muskoka in the first 9 months of 2020, which was 50% high. So that's huge than the comparable average of the previous 3 years. And the city of Barrie in particular has been disproportionately impacted by this recent increase, with 47 of the, or 50% of these deaths occurring in Barrie. And this is only up to midway through September. And, you know, Barrie only accounts for 25% of the population. So I do want to say that in that early discussion that involved the local MPs and MPPs, and in the many discussions we've had with the mayor and city council, I think everybody is on the same page around the severity of this issue. I think where we still are coming together is on the solutions. So I think, what we've been trying to do, and Kim's leadership has been phenomenal, is to say the supervised consumption site is but one part of the courts with mental illness or living with an addiction. So what we need to do is fill in the gaps that exist here in the region. And there's something I just needed to shout out so that the community knows. Meredith and I, over the summer months, with some of our team members, were successful in actually getting funding for an in-home withdrawal management service as well, and some further day and evening addiction services. And again, in December, we submitted for, hopefully you heard on that, but, fingers crossed, hopefully our MPPs are listening. We'll actually be successful in that funding as well. So what we're trying to do with our partners and really listening to our community and really trying to respond to this urgent crisis is fill in the gaps in this region, possible services and supports. But yeah, do we have a ways to go? I mean, when you think about it, in a city that's only over 150,000 people, to have 94 confirmed deaths in the region, and then 50%, 47 in Barrie, that's substantive. And up until recently, that's a higher death rate than the pandemic, right? So we have to remember that. And if we go year over year over year over year, it's actually just shocking that, because of, I think, societal views, that we're not seeing this as, if it's not the number one crisis for the minute the pandemic starts to resolve, a little more program takes over. So will we put the same time and attention in? I hope we do. And I will, on behalf of CMHA and or clients, continue to advocate for doing the right thing.
I think a major theme from our discussion is that these issues and these crises are really multi-layered, and there's so many things below the surface of opioid use, and there's so many things besides a supervised consumption site that you all are doing to address the crisis. I'll start with you, Kim. Is there something that you would want the public to know about the fight against the opioid crisis, or something you don't think is talked about enough about the work that you're doing?
I think it really just comes back to sort of the root, where does addiction come from? And, the community at large often thinks about any drug use or any illegal drug use, perhaps, as being a bad thing and automatically an addiction. And that's not the case. Many people use for enjoyment and can use without it being problematic. But for those who get to the point where it is problematic, it's also, as Meredith said earlier, it's a bit of a symptom, but it's also, it's so intertwined with the other factors of life. You might look at it as is the housing, did the lack of housing lead to addiction, or did the addiction lead to a loss of housing? Is a cause in the process or as an effect in the process? And there's no one answer, it's both. And it is, I guess it's just a little bit of a changing of the mind from how the long-standing stigma and perception about addiction has been viewed, trying to look at it in a different way. If that makes some sense.
That does, yeah. Thank you for that. I'll pass that on to you, Meredith. Is there anything in Barrie, in the discussion about the opioid crisis or the supervised consumption site discussion, is there anything that you think is being missed, or anything that you'd want the public to know about the work that you're doing?
I think one of the pieces that's really important is to know that if we're not treating the root causes of addiction, then we're not actually treating the addiction itself. And so when we talk about an SPS as being a complement to the existing services, that's because what we know about the engagement process for people to start looking at treatment or start looking at making changes is that it needs to be multifaceted, and that there needs to be different levels and different ways for people to engage in that process, because different people. So the same way that no one treatment modality is to be the fit for that particular person, there needs to be lots and lots of different types of options and different ways for people to engage in those processes and to feel safe about engaging in those processes. So really looking at all the different ways that we can address this, and then remove that stigma from the fact that substance use is not a moral failing or just all about willpower. That this is in fact a really complex issue and requires a really complex solution to that situation.
Well, thank you all so much for your time. Just to end, I was wondering, is there anything else you wanted to say or anything you didn't get a chance to speak about today?
Well, I just wanted to thank you for the opportunity to actually share our perspectives and to highlight this crisis, because it is, and the importance of us all coming together and co-creating solutions and listening to our people that are living with their addictions and or are being, their lives are being impacted by substance use or mental illness. And I think, in so many ways, the pandemic, with all of the discussion about mental health and well-being and substance use, has been a good thing. But, I always believe we don't need a crisis like a pandemic for us to focus on this, right? This has been a decade-old problem. And when I say problem, I mean for really, truly the individuals, the impacts it's having on their lives, as Kim highlighted, losing one's house because of substance use. And I want to reiterate, we're all complicit in this, right? Turning our back and saying no SCS in my community is actually denying people the appropriate service and support to potentially get back in safe and affordable housing. So we have to figure it out together, and we're here to listen. And I just wanted to, for that mother that you talked about, whose child passed away due to opioid toxicity, we're here to listen, and we're here to advocate on behalf of your loss and your experience being a parent in a system that's not always listening. So I just want to thank you for that.
Well, I want to thank you all for the work that you're doing. And I think a lot of the time the work that individual people like you and in your organizations are doing to combat the crisis on the ground and working with people gets overlooked. So thank you for that. And thank you for taking the time to speak with me. But as I said before, the opioid crisis is just that, a crisis, and lives are at stake. So we want to be mindful and respectful about who we have on and the perspectives we bring to the table. We'll be talking next to a group of activists holding a vigil in remembrance of the lives lost to the toxic drug supply. And they're also a group pushing for a supervised consumption site in downtown Barrie through online petitions. The conversation continues, and the crisis continues as well.